520 million all source revenue, meaning the revenue has been on an upward trajectory. I think maybe she can read how much she used to collect 2 years ago per day in her hospital and how much she's now collecting.
Thank you, Chair and members. We used to collect around 70,000 per day, and currently we are collecting over 350,000 cash revenue. And on SHA claims, NHIF prior used to pay us around 3 to 5 million per month. As of last month, we claimed 39 million in 1 month. Thank you.
Chair.
Hamida, you are from the health committee.
Yes, the revealing truth. Let me shock you. We went to one of the hospitals. I will not name the hospital. And there were very few drugs. It was like they didn't have drugs. So then we were given a tip. So we go to another town. We find the chief pharmacist from that pharmacy is the distributor of medicine, of drugs, the whole town. So we entered into his pharmacy and we insisted that we wanted to go to his store. And it was well stocked enough even for I don't know how many hospitals, different hospitals to provide. That chief pharmacist from that hospital wasn't in hospital, he wasn't on duty, but then we found him in that pharmacy, whereas his distributor of the whole town, the whole county, whatever town. And the pharmacy was busy, distributing the store. When we went to the store, oh my God, we could not believe it. And that pharmacy didn't have medicine. And we did that, of course, to other counties again. We even did that to Marsabit last time. And we found, of course, the mushroomed, pharmacies. They're all their pharmacies. So I'm hoping the chief pharmacies, seriously, it was so bad, Chair. So I am just telling Gava, I don't know. I don't know. This is not 1 county, 2 counties, or 3 counties. We found that the same pharmacies are the distributors of the other, not hospitals, but then all the other pharmacies. So I don't know how you.
No, just for avoidance of doubt, I think it is fair for the Honourable Senator to disclose whether it was Muranga or not, because oh, good.
I'm just making you aware that coming to Muranga, by the way.
Yeah.
Yes, Senator Newt.
Yeah, I was also a member of the health committee before I was unceremoniously thrown out. And I say that because, Chair, when I was serving in that committee, we were able to visit GOTRH in Kisumu. And they had the same cry that the governor of Muranga has, that they were serving so many patients from outside the county of Kisumu. And what that particular county then decided to do was to apply to government to make it, I think, a level 6. Where then, and I think it has already been taken over by the national government. Because it's very challenging, Chair, where any particular county with its limited resources then is serving many other counties. So that through you then, I may want to ask the governor of Muranga, if Muranga is carrying the burden of other neighboring counties, would you consider then requesting the national government to take over Muranga level 5, so that then the national government funds that particular facility for the benefit of the people of Muranga and those from neighboring counties? Because you cannot turn away a patient simply because they come from a neighboring county. So exactly what would your position be? As a county government, would you think you can borrow a leaf from GOTRH in Kisumu, or you would rather continue funding the same hospital from the limited county resources?
You know, Senator Newton Kisumu was here, and if you listen to the deliberation in this committee, you would have noted that sometimes those hospitals which are being upgraded do not even qualify for upgrade. They do not. As per the health standards, which we will be looking, the UHCL standard, they don't qualify. But it's just a convenience, yani wacha shida iniondoke.
Chair, I wanted
But
to,
Governor will respond to that.
before the government responds, I also wanted to weigh in, Chair. You know, Chairman, you know, if there are issues, like for Muranga, if his neighbor is having an issue, people are on strike, maybe instead of asking for upgrade to the next to level 6 so that the national government takes over, which we are saying, we know we are clawing back on devolution. Basically, it means one by one, we'll be giving out our hospitals back to national government, that they are going to put in resources. Some of them are even struggling. They don't even get enough from treasury to run them. So maybe it's a better way is maybe for the governors to, they have a caucus, they have those regional blocks. Then maybe the hospitals need to find a way of identifying the hospital, the patients from the neighbors. And then eventually, when we are giving conditional grant, then we identify those hospitals, level 5, that are getting patients from maybe Cosmopolitan, say, I'm sure even Thika could be also receiving patients from Muranga. So we identify them and give some conditional grant to support them instead of ceding them to national government.
We found the same, Chair, with Laikipia. Laikipia serves about 6 to 7 counties. There's Samburu, Isiolo, Marsabit, Meru, you know, all of them. So in Laikipia, you even find people from Samburu, they cannot even communicate in English, neither, you know. They are all there. So it's having like between 6 and 7 counties. Yeah, so definitely that one, you know,
So let's have the governor response. And governor, as you respond to that, we have made a general observation in this committee that we have two main issues in hospitals. Number one is insufficient drugs in the hospitals. Number two, cases of expired drugs. Drugs which have past the expiry date. But adjacent to the hospitals, we have well-stocked chemists which are flourishing. I don't know, is that the case in Muranga? Where we have several chemists which have been established near the referral hospital, which are doing so well and have all the drugs that you need. But in the main hospital, there is no, we have inadequate drugs. Is that the case in Muranga? You can respond to all those questions.
Okay, first is that in terms of how our health system, or rather our hospitals are, the more believable person definitely is the senator, not us, because he is looking us from the outside than us. We may talk more positive about ourselves, and he is probably he gets more better feedback than those who are inside. However, as to the suggestion whether Muranga should become a level 6, incidentally, we wouldn't mind anything that needs to be done to make health services better. If that would improve things, we will definitely be, we can consider such kind of a discussion. Of course, we know what it means. It means a university has to be established, offering medical school, more staff, maybe even potentially, I don't know whether an act of parliament establishing Muranga as a standalone level 6 hospital. So there are many things that ought to be done, but we wouldn't mind, we wouldn't hold on anything just because it is a county hospital. However, the refill rate of Muranga Hospital is 80%, meaning all factors remaining constant. Out of 10 prescriptions that are done by a doctor, a Muranga person in Muranga level 5 will miss only 20 or 2. Out of 10, he will miss 2. Others will get 8. And but if indeed that is not the case, we will be happy to hear any criticism. But we feel that our refill rate is very, very high. Secondly, the issue concerning the future of, or rather the hospital, whether is the future looking good? Yes, the answer is yes. The only issue for us currently that ought to be fixed, and the hospitals are very okay, is SHA reimbursements. I say so because SHA owes Muranga 107 million Kenya shillings. If that was to be, if that was to be paid to us, the hospitals would definitely be very good. I say so because the Senate, in its wisdom, passed a very important legislation called FIF, meaning every coin which is now being generated by the hospitals is being retained by each medical facility. That has turned around the fortunes of our hospitals. And Muranga level 5, for instance, as at now has a bed capacity of about 285, but the current number?
Occupancy 400 patients.
400 patients. The demand is very high, but we are happy in the next 2 weeks we shall open a new block that will host, that will create an extra 100 inpatient beds. You go to Muranga used to have 10 inpatients. Now we are having about 50. Kigumo, there were no inpatient beds. Now we do have them. Kandara, there were no inpatient wards, a whole sub-county. Now we do have them. So the point is, when you go to Madhya, we are now opening a new level 4 hospital in the next 3 months or so. Kirwara the same. Kirwara used to not to have any inpatient wards. So the point is, we believe if SHA was to reimburse promptly our claims, the future of Medicare in Muranga would be a little bit better. Not perfect, definitely, but on a positive trajectory.
Chair, I have a follow-up question to the governor. When you forward your claims to SHA, what response do you get of delaying these reimbursements for so long and yet they've received from the hospital?
Chair, I also, sorry, just to ride on to that one, I also realized that SHA does not pay, in all the hospitals, does not pay outpatient. So we realized most of the patients were stuck. No payments were being made, so they had to pay, from their own money, being the outpatients. So it was, by the way, the inpatients were well taken care of, but then not the outpatient. Then just one more that I wanted to alert the automation is that automation has to be monitored, because we also realize in some hospitals you have the gadget, or is it but then they're unable to use it. So you could have a good idea of that automation, but then they're unable to use it well, and very well if it's not monitored, you may find a lot of
So I members, let me allow the governor to respond to to all the issues and then we make progress. Yeah, including what she has raised.
Yes, I think the second issue was just a comment. So let me go to the first one raised by Senator of Machakos and state that we receive no response.
What about the issue of pharmacies operating around the hospital? The issue I had raised.
Yes, it is true. We do have pharmacies near our hospitals. We have no evidence to establish a link that creates ground for misdeeds. And therefore, without that, we may not take action, Chair, because, we are operating in a free market and you have to respect private businesses. Until the day you get clear evidence to show that indeed our drugs find themselves into those pharmacies, we'll definitely take action. However, be informed that 2 months after we got into office, that is the year 2002, 2022, there was some subordinate staff, how many? About 10, who were caught with the county medicine, and they were arrested, and the case is pending before Muranga Law Courts, and therefore the point we are bringing is that problem definitely potentially exists, but we suspect after automation that problem has gone down. Thank you.
Yes, your last question.
Chair, I just want to ask the governor, because he's been there when NHIF was working and now SHA. When you compare the two, when were the hospitals receiving their funds promptly when you compare the two?
Okay, let me start with the negatives of SHA, and then I say the positive of SHA in comparison with the NHIF. The negatives of SHA in comparison with the NHIF, they include that we used to receive monies from NHIF more frequently, isn't it? Yeah, we used to receive. Yeah, we used to receive. Yeah, correct. Yeah, we used to receive NHIF monies more frequently, and therefore. And therefore NHIF tended to be a little bit better in comparison to the current system. However, SHA has some positive. Yeah. Oh, okay. The second negative of SHA is that the downtime of its systems. It's system-based. So once in a blue moon, and quite frequently, the systems come down. That then creates a lot of problems. But they are positive, let me admit. And the first positive is that there is real-time tracking of patients' invoices. NHIF would pay us money. We would not know whether that money concerned patient Atieno, patient Kamau, patient Joroge, or Musikali. Yeah, you will just find 10 million sent from NHIF. We wouldn't know. But now this one, you are clearly able to know the money sent is in respect to what. Secondly, there is a dashboard of SHA. NHIF did not have a dashboard. Of course, from the patient point of view, there's a complaint that SHA seems to be more expensive, yeah, on average, because NHIF used to charge 500 shilling, but we have had people, when they do you that mean testing, you are told to pay 1,000. So there's that negative on the SHA part. But us as institutions, it appears a little bit more transparent than NHIF. In fact, for us, we think that if SHA just pays us our money, we might prefer SHA. We might prefer SHA if it pays. In fact, it has better rates. Yeah, it has better rates. I mean, let's say like the refund for certain procedures and processes, the rate is a little bit high. Allow me to ask Dr. Mbogwa to.
Thank you, Chair. My name is Dr. Mbogwa once again. I happen to be a gynae by profession, so when Governor talks about packages, it is true what he's saying. Because with the SHA, a major operation will go for about 89,000, which was not the case with NHIF. Maternities usually tend to be quite busy in our hospitals. With the level 5, we are doing about 400 deliveries a month. And with the SHA rebate of about 30,000 per cesarean and 10,000 per normal delivery, the hospitals are able to generate good revenue. So from our point of view as health service providers, we feel SHA is headed in the right direction as far as funding of hospitals is concerned. Thank you.
To make progress.
So what do you think should be done? Because we are here to defend the counties, eh? You are the Senate, you know, we are defenders of counties. What do you think we can do to help in the situation of SHA not paying promptly?
Thank you, Chair. You need to summon SHA people here. Ask them, why are you not paying counties? They owe Muranga 107 million Kenya shilling. We need that money as soon as yesterday. Yeah. You also need to inquire whether they are giving preference to private hospitals over public hospitals. Yeah. Thirdly, you need to tell them to increase the money they send to us for outpatient services. We have a model called capitation. That is, once you join SHA, you choose your outpatient facility, then they send that money to the facility. It is too little, and it cannot compensate for the outpatient services. Finally, SHA owes Muranga some money for our medical cover that we have for the poor people of Muranga. They have refused to pay us back that money. When we signed with them, I think that was the year 2024, the second year, there was a clause there for administration fee. When we do recruitment for that scheme, we send some clerks there to do the recruitment. We are supposed to give them some allowances. So SHA was supposed to pay us. They have not paid us about 8 million. As we have paid them premiums, we have never failed to pay them premiums for that cover. But when we tell them now, okay, refund us administration fee, they have not paid us that money. So, Senator Machakos, please call SHA people, issue them summon, sanction them, tell them to pay Muranga administration fee for that scheme.
Through you, Chair.
I want us to make.
Through you, Chair. Just one last one.
We have 4 reports to.
Just one last one. Since you sit with the COG, why don't you come up with all what you are facing in hospitals and how much SHA owes each county, so that now as we call them here, we have something substantial to come and question them about through the COG. Kindly.
Noted, Chair.
Thank you.
Yeah, and lastly, I wish you comment on the money that SHA owes you, NHIF money. As was 22,262,460. What are you doing about it?
Yes, Chair. Yesterday we were supposed to have a meeting with NHIF. SHA. Yeah, to press for the 107 million, press for the 22 million by NHIF, press for that money, their administration fee for that scheme for the poor. But the SHA bosses were unavailable. We hope they will give us a new appointment next week.
It's good to make progress, but I just wanted to declare some interest that the system NHIF was using, I'm the one who was doing it.
The system?
Yes.
They are using?
Yeah, NHIF, and basically what the governor has said, the NHIF system, they're still running in the background on other issues, and it's never been down. It was never down. I'm sure the doctor will tell you. It was a very stable system. And the problem that you have now is SHA actually is not collecting the money. It's been collected elsewhere, and they get 5% administration. Even if you have a meeting with SHA, unless you have with the ministry is still the one who is micromanaging SHA.
That is coming from an expert in that area. And the other thing I wanted to say from the IT perspective, I think having the automation is key, but integration, because how you can integrate the hospitals seamlessly to maybe your warehouse, so that if I want to dispense medicine, I will check where it's available. Is it in the warehouse? Is it in this other hospital? So that integration is very key. When we visited Kilifi, we saw for ourselves how that is done. That the person sitting in equivalent of Maragua can actually check the stock levels in the warehouse and in the other hospitals. So that helps a lot. Integrated inventory management in all your hospitals. So that will help you in ensuring that you have a proper distribution plan. You are able to monitor your stock levels real time from any point where you are. So I think we'll have an opportunity to visit Muranga to see for ourselves what is there in terms of automation. But we highly encourage automation so that we can have a better process of managing drugs in the county hospitals. Honorable members, let's proceed to the last query.
Board for recruitment of staff. Staff shortages have been adequately communicated and are gradually being addressed as per the budget allow.
Comment from the auditor?
Chair, thank you. I think the issue is remain unaddressed as the governor is saying because they don't have the capacity. They rely on public, county public service board.
Maybe my CC can say something more.
And talk about equipments also, because I can see the focus in the response is just on staff. But the query is talking about equipment used.
Thank you, Chair. Health is one very, very demanding department as far as services is concerned. All hospitals, especially the main hospitals, the level 4s and 5s, usually have several departments. So the demand in terms of human resources for health is always quite high. Number two, the natural attrition of our staff. We are having staff who are retiring. We are having staff who are going elsewhere. So there is no single time that you'll find our facilities have enough in terms of human resources for health. As Muranga County government, what we are doing right now through the County Public Service Board and through the County Assembly, we are recruiting based on available resources, but keeping in mind that we don't surpass the recurrent budget as far as finance is concerned. Our governor came up with an idea of having interns hired to fill gaps, and that is what we are doing to run especially the nursing department, so that we take care of the dispensaries and health centers, because in the spirit of universal healthcare, we always talk of the 3 A's, that is the accessibility of services, availability of services, and acceptability. So by making sure all our level 2s and 3s are running, we are able to reduce the workload in the main hospitals. So as a county, we have tried to use the interns. Number two, we plan to keep having recruitments done based on revenue. Muranga County government was able to raise revenue about 1.1 billion last year, and now we are targeting to raise roughly about 1.4 billion, God willing. The more revenue we raise as a county, the more our chances of filling the gaps in HRH. So we are optimistic that we should be able to fill some of these gaps. Thank you, Chair.
I haven't heard anything about equipments.
Yes, Chair, the truth is our budget is quite constrained in several measures, but the county government came up with ideas on how to remedy the problem of equipment. We have been doing placement model. We have also been purchasing several equipments. We are like recently we purchased. Allow me to give to the Daktari to give the recently purchased equipments.
Thank you, Your Excellency. Chair and honorable members, we have a new building coming up that is going to have 4 theaters that are fully equipped. We have additional beds. We're going to establish a cancer center, a clinic there. We have a placement of equipment in laboratory and diagnostics, the X-rays, even coming from the national government. So I believe that this audit report will not be there in the current financial year.
Yeah, just to mention, we have bought new X-ray that was installed at Kirwara. Yeah, we have also bought a new dental chair that was installed at Kenneth Matiba. We have an ECG that is now in Maragua. We have several other equipments that we have been buying, including ambulances. But of course, there are problems. Let me admit, there are 2 problems we are seeing in that area. One, the MRI and the CT scan. They were placed there by the previous government. They have basically come to an end of the lifespan, and therefore there is a proposal by the national government to do fresh placement, which we signed, and I think we signed for X-ray. Now we don't think we need really X-rays because we have bought few X-rays in Muranga. But MRI and CT scan, we do need them, Chair. Now that the old one will be decommissioned, Muranga wants the placement from the national government. The problem is on that one. The new placement model is very oppressive to counties. For instance, I think they are proposing, is it 7,000 for MRI? That's the amount we shall be charging patients. But they will be refunding us 1,000 only. Now 1,000, you have electricity, you have several other inputs. Surely, I think on that one, we feel this one will not work. The other option is to buy, which is very expensive. So we are considering a parallel placement model. Muranga has a placement for dialysis machines. There used to be 4 dialysis machines in Muranga, level 5 hospital. They are now 15. We used to have, Kigumo did not have these machines. Kigumo now has 4, 5. Yeah. Now, and finally, we have a mobile truck that has 4 dialysis machines that is serving Gatura Dispensary, Kirwara Hospital, and Maragua. Thank you.
The message I'm hearing, Governor, is that the NESP, which is the new program, the NESP, the National Equipment Service Program, is not as good as we've been told by your colleagues who have appeared before us. Because they gave us an impression that the NESP is better than the MES. Now, I think it's you who's telling us for the first time that actually it's very, it's not as we have always been told, that it's better than the MES.
Yes, better MES than NESP.
Yeah.
By far. By far.
Yeah. So
In fact,
let me have Senator Muranga.
Thank you, Chair. I don't know whether it's me that is lost. I thought we are dealing with the deficiencies in implementation of universal health coverage and staffing. So now, depending on from the response of the governor and the MedSoup, you know, that we will have even a new cancer center, which is a very exciting idea, that we are buying machines to serve our people. But then, Chair, I think that with these developments, we will need even a higher staff, more staff members. So I was struggling to get exactly what the plan is to recruit more medical staff, even as we expand on these other services, because of course those machines, and I believe that once we bring in these new services, of course we are going to attract even more patients. Exactly how are we going to, see to it that we have adequate medical staff? Thank you.
In fact, Governor, if you're looking at the numbers, and I hope these numbers are only for Muranga level 5. We have different numbers for the other hospitals. And the same query has appeared in the other hospitals. The numbers in Muranga level 5 is too low. You have 28% of what is required, which means you have a deficiency of 72%. So how do you bridge the gap? Are you using cashews? And how many cashews are you using, if there are any? Because we're just wondering how you are able to breach a gap of 72% of staff requirement.
Chair, can I write on to your question?
Yes.
Because when a governor also said that they're using interns, so I also wanted to ask whether the interns are being paid. Because we found the same in other hospitals and they're doing a lot of work seriously. So I'm just wondering, are they being paid? And also with the current equipments that you're going to bring, seriously, this is music to my ear and it's so exciting. With the cancer center and all that, we will definitely have to visit and also benchmark if this is the way to go. But then I'm just wondering, you need professionals to operate on these equipments, and yet the variance of the staffing is quite high. The percentage is quite high. So how are you going to do it? As much as you're moving to another level, but then the staffing rate is very low. So I'm just wondering how the comparability. Thank you.
Governor?
Yes, first allow me to clarify the cancer center is not really the conventional cancer center. It's not high tech and very sophisticated. I think the journey of creating a cancer center requires more robust investment, which for now we do not have. So allow me to clarify a little bit that I do not want to come after 3 months, you are looking for the cancer center and you can't see it. So it's just maybe cancer consultancy. Let me put it that way. 1 or 2 doctors who may be expert in cancer, they might get a space. Muranga wage bill is about 45% or so beyond the legal threshold of 35%. We were supposed to downsize as per the advice of the various oversight bodies, but we refused because we felt, 1, we need those staff, 2, it is immoral to send employees home. And therefore, we really don't have a lot of legroom to add more staff. If we do so, we will be violating the law more to creating an unsustainable wage bill. So the truth is, yes, it is true, these numbers require we need to put more staff, but our budget is quite constrained. Be that as it may, we came up with a policy of something we call internship. It's a policy passed by the Assembly. We announce who is a nurse, clinic officers who wants to do internship. People apply and they are vetted and they are given the position of interns. They usually work for 1 or 2 years, then we absorb them into the formal employment. That has 2 positives. Number 1, yes, we pay them, but are slightly lower. So that delays the shock on our resources, because if we had employed them immediately as, let's say, substantive nurse, you'd be paying that nurse about 70-something thousand. But as an intern, you come in at 30,000. It also gives us a time to plan and to increase more revenue in that 1 year before we absorb it. The first cohort has now been absorbed. We have now announced another cohort for health professionals to joining as intern. We pay them a little bit low because basically internship is that you are a student. Then later on we will absorb you and we pay you as per the standard rates set by law for substantive county employees. It has helped us mitigate this problem to a large extent. But healthcare is the only sector that Muranga has been employing, even substantively. We say so, like I think we have employed about 15 or so new doctors even clinical officers, among the very few counties that employ clinical officers. And we have a program called telemedicine, domiciled at Muriranjas. That's where most of those people have been going to carry out that program. So the point is, Mr. Chair, yes, we look bad on the books, but give us time, we will progressively remedy.
Chair, I still want to ask His Excellency the Governor what they are doing as COG for more funds to be devolved for health, because health is devolved and we still have a lot of funds in the national government. And yet, all the work that you are doing at the county level is so much and you don't have the resources. We are fighting for you here. But as COG, what are you doing for more funds to be devolved so that you can employ these nurses and doctors comfortably? Because when they were in the national government, they were being employed. Thank you.
I think you should talk about IBEC, not COG. IBEC. What are you doing in IBEC?
But you see, the COG should now push the IPEC without them complaining to the IPEC and putting their demands to the IPEC. IPEC will not be able to push it for you. You are the ones who are feeling the pinch. Thank you.
Chair, so that we can maybe close on this one, I just wanted to find out the status. It's not an audit query. The actual status, if he has implemented the FIF Act, because that's what can also help the Rivara Hospital. And then secondly, Chair, I was in the mediation committee when we negotiated from 4.5 to 4.15, and I'm told governors had already agreed on 4.5 with the executive. When you sit, because I'm told also yesterday you were at IPEC, why are you still allowing the national government to retain money for primary health? It's devolved.
Yeah, there is a feeling in the Senate where you have been that even as senators are pushing for more resources, the governors are quick to accept low funds and they are quick to make deals without involving the Senate. And the road maintenance levy fund is a case in point. That's what she's trying to raise. Proceed, Governor.
Yes, I think the best the counties can do is to agitate. And we have been agitating at CUG. But the people with the teeth to bite is Senate. And we are really thankful the role we have been doing to push for more funds to be devolved and really urge you to continue with the good work to ensure counties are not oppressed, and because we need those extra funds to push through. Now, Muranga has developed a policy called Locum. It is awaiting endorsement by the Assembly. Locum policy proposes to allow hospitals to hire on short-term basis health workers, particularly in instances of emergencies. Take, for instance, when there was COVID or when there's an accident. I think medical soups together with CEC Health, they need to get some leg room to hire employees. Maybe even Locum can even, Locum tends to be more for medical professionals, but I don't know whether a clause can be inside casuals, cleaning. I say so because like now Muranga, now that new block we shall open, the new wards in Maragua, the new wards in Kandara, the new huge block work in Kigumo, all of them, they require extra staff. And you know, if we employ through public service board, to be chaotic and to be quite problematic. But now, the assembly wrote to us back saying that they think Locum policy is encroaching on the legal mandate of the public service board. Maybe the Senate can consider doing an amendment of the various national laws on health to allow, like the way you did FIF, so you grant powers to the hospitals to do locum, to do locum, and I think that can be helpful to hospitals. So allow me to throw the ball to you, and I urge you to consider embedding the idea of locum into some national legislation. Thank you.
Chair, but
That there's definitely, we need to do more.